Welcome to Ask Dr. Clark's Sex Offender Education Series. I'm her producer, Tom. Dr. Clark, do all pedophiles act on their desires?
So a pedophile, just to remind everyone, a pedophile is someone whose primary arousal object is a child, a prepubescent child. This means that they are sexually attracted to children, and very seldom are they attracted to adults, and if they do have sex with adults, they're probably fantasizing about children while they're doing it. So far, up until recently, we've thought that all pedophiles are sooner or later going to act out. That's been based on a forensic population, the number of pedophiles who are caught and in prison, and we find out that they've had hundreds, if not thousands, of victims, that they have a real high level of obsessive compulsive thinking and behavior going on. And so the popular thinking for years and years and years has been that pedophiles will inevitably act out. More recently, we're finding out that no, that's not true. Not all pedophiles will act out. And so what's developed recently is a term called MAPS, minor attracted persons, or non-offending pedophiles. And this is a group of people that, thanks to the internet, have managed to create some groups that allow them online to get together and work hard to support each other in not acting out, in not having sex with a child, and not becoming a sex offender. So a minor attracted person is someone who is attracted to minors, who by the DSM, the Diagnostic Statistical Manual of Psychiatric Disorders, says a pedophile is someone who has either acted out their fantasies, their urges and desires with a child, or has them, just has them. You can be diagnosed as a pedophile, having pedophilic disorder, as they say, simply by having fantasies and urges about prepubescent children. But this group of people says, no, we don't have to act out on this. So we may be pedophiles, but that's a nasty word. And so minor attracted persons is a more pro-social word to use. It's more affirming. It's saying, this is who I am. I'm a minor attracted person who doesn't need to act out on this. And a lot of therapists are beginning to treat minor attracted persons, MAPS, which is a wonderful thing, because who needs therapy more? In the past, therapists did not want to treat anyone that walked in their door and said, I'm attracted to children, because that therapist would be thinking that sooner or later that person's going to act out with a child, and then the therapist is going to have to report them. And that's mandatory. It's mandatory that I as a therapist, if you come and tell me you did act out with a child, I do have to report you. But if you tell me you want to act out with children, or you have urges, but you don't want to, you actually don't want to act out on them, you just have those urges, then I certainly don't have to report you. We're not the thought police. So I don't have to report you. I can give you the warning that if you do tell me you act out with a child, I will have to report you. But meanwhile, I can help you. I can help you submerge those urges, redirect those urges. See if you can be attracted, shift your attraction to age-appropriate partners, or do whatever it takes to quell your sex drive so that you won't act out. One of the resources we have for this is the internet. So there's one website called Before You Act. It's B4, number 4, U, the letter U, act. I think it's .com. So Before You Act, you can Google that, or VIRPED, V as in Victor, IRPED, Virtuous Pedophiles. So the Virtuous Pedophiles website is also a place you can go for help. And that in conjunction with therapy can be really effective in keeping the non-offending pedophile, the MAP, from acting out. And what's really important is protecting children. Thank you.
Now, as a quick follow-up to that question, is there any research or understanding on how someone finds themselves attracted to a minor? Is it conditioning? Is there something happening generally cognitively or something neurologically wrong? Or has there been any research into what leads to this in people?
Yeah, that's a great question. It could be both, either or both. One of the schools of thought that's becoming more prominent is that pedophilia is similar to orientation in that people are born and they're born with this orientation to this group of people. So, for instance, someone with a homosexual orientation is attracted to same-sex partners, heterosexual, other sex, bisexual, so on. And that pedophiles, it's an orientation that they're attracted to children. I go along with the born part. I can totally go along that some people are born pedophiles. What I don't go along with is calling it an orientation. I'm going to tell you why. Because there are a lot of people out there that subscribe to that point of view, and I do not. Someone who has, say, a homosexual orientation or a heterosexual orientation, they're attracted to a group of people based on their, whether their gender, okay? But it's about relationships. So I personally identify as heterosexual woman. I'm attracted to men. I'm attracted to heterosexual men, okay? And when I fell in love with my husband, it was 38 years ago. And I have been in love with him for 38 years. And I fell in love with him when I was an adult, he was an adult, and now we've aged together, we've grown together, we've been in, and we're, the attraction is still there. If I was a pedophile, then I would have fallen in love with him when he was a child. And then as he aged, after a year or two, I wouldn't have been in love with him. You see, it would be an object, because he would have been an object. And we can be in love with objects. Think about our cell phones. Think about other objects. We objectify people all the time. We'll have a checklist of what we want in a partner. That's objectifying. We have a lot of guys who will objectify women. They'll say, oh, I'm a leg man, I'm a breast man, and So women objectify men. They'll do it in a little more romantic way. They'll say, oh, he's wearing this cowboy hat, and so I like the idea of him as a cowboy, kind of thing. So there's an objectification going on. And those relationships don't last, do they? But when you fall in love with someone based on their gender, because you're homosexual, heterosexual, or other, something else, but it's about relationship. Paraphilias, paraphilics, pedophiles, it's not relationship oriented. Okay, be real clear, it's not a relationship. It's, I like this object, and as long as this object remains like this, so 8 years old, okay, we can go 7 to 9, but that's it. It's not going to last longer than that. And I think the idea of trying to say pedophilia is an orientation really does a disservice to homosexuals, because we have a long history of people thinking that, oh, that homosexual teacher is going to seduce our children. People have seen homosexual men as predators, and they're not, and that's horrible. And I think it's really important not to do anything that buys into that. Now, could some people become pedophiles? Well, it's been really difficult to research, and probably, we get conditioned as children We get conditioned to different objects or arousal templates. We form arousal templates as children, what turns us on. And so sometimes for kids who are abused, kids who just somehow get sexualized at a young age and get conditioned to be sexual with someone else who's young, will that person turn into a pedophile? So maybe. It remains to be seen, does that pedophile, is it really a pedophile or a child molester? And that person grows up and is molesting children. Is that someone whose arousal template is immutable? Children are what turns that person on. Or is this someone who's able to redirect their sex drive with the help of a lot of therapy, a lot of intervention, a lot of mindfulness and intention? Are they able to grow up and be interested in age-appropriate partners? So you're going to hear a lot of different people say a lot of different things about this. And, you know, the takeaway for all of you out there is to know that therapy works, that whatever you are, and the people doing therapy with people who've been arrested for molesting children are trained. There's a lot of education they need, a lot of experience to be able to work with sex offenders. And so they're going to be working with those sex offenders to see how much can they change their sexual desire, where their attractions lie, or is it immutable and we have to just tamp down their sex drive? And so sex offender treatment programs will have different interventions that they employ for this purpose. For the rest of you, you want to know, are my children safe? Are the children in our world safe? How do we keep children safe? And we're going to talk about that in another video.